Do you know what vaccines people over the age of 50 should receive? Do you know where you can get these vaccines? By the end of this video, you will know what vaccinations are recommended for people over the age of 50 and where to get them. By subscribing to my channel and hitting that little bell, you'll be notified every Monday when I post a new video that is designed to help you navigate the sometimes confusing healthcare system. I'm Dr. Snow, and as a pharmacist for more than 30 years, I've helped thousands of patients make decisions on what vaccinations they need to be receiving. Vaccines that prevent diseases such as polio, tetanus, and measles have saved countless lives over the past 50 years. Once you hit 50 years, it's time for a whole new round of vaccines to help you stay healthy in your older years. Everyone who is alive should get a tetanus shot every 10 years. The recommended adult tetanus vaccine is the Tdap, which also includes diphtheria and pertussis. Pertussis is also known as whooping cough. Tetanus is a nasty disease that is caused by a bacterial poison that enters the body through a cut or a wound. Formerly known as lockjaw, tetanus affects the nervous system and causes extreme muscle spasms. The term lockjaw comes from the muscle spasms that occur in the jaw, preventing the patient from opening their mouth and preventing them from swallowing. Those who survive tetanus may end up spending weeks in the hospital, in ICU, and on a ventilator. Tetanus results in death 10 to 20% of the time. Patients often die of suffocation because of the muscle spasms. Tetanus is a nasty way to die and is preventable if you just stay up to date on your vaccination. Shingles is a viral disease that is caused by the same virus that causes chickenpox. If you ever had chickenpox, you could develop shingles. Shingles is more common in older adults and in those with a compromised immune system. If you get shingles, you are contagious to anyone who ever had the chickenpox or anyone whose immune system isn't working properly. You should stay away from babies, anyone that has HIV or AIDS, pregnant women, and anyone who's had cancer. Also, you should avoid transplant patients who are being treated with anti-rejection medications. One of the more devastating complications of shingles is called postherpetic neuralgia. This is nerve pain that lasts long after the rash is healed, and it may never go away. Also, depending on what nerves are affected, facial paralysis, hearing loss, vision loss, balance issues, and inflammation of the brain may occur. Zostavax is the first vaccination that was introduced in 2006. Zostavax is given as a single injection, and protection lasts about 5 years. In 2017, a new 2-injection vaccine was introduced called Shingles. The first dose of Shingles is administered, and then the second dose is given at least 2 months, but not more than 6 months later. Shingles protection lasts more than 5 years. Getting the shingles vaccine doesn't guarantee you won't get the shingles, but the severity of the disease will be less, and your risk of getting postherpetic neuralgia is much lessened. Have you ever had, or do you know someone that's had shingles? Comment below if you think the vaccine would have been much better than the shingles. The flu vaccine is recommended for everyone over the age of 6 months. Older adults are at risk for serious complications if they get the flu. These complications may include pneumonia, dangerously high blood sugars in diabetic patients, and heart attacks in patients who have heart disease. About 85% of the flu-related deaths occur in those patients over the age of 65. Because elderly adults' immune systems don't work as well as younger people, it is recommended that you get the high-dose flu vaccine every year. The flu vaccine protects you from the flu for about 1 year because the influenza virus mutates or changes rapidly, and a new flu vaccine must be developed every year. While the flu vaccine does not protect against every strain of the flu every year, there are enough similarities between the strains of virus that even if you do get the flu, it will be much less severe. The CDC recommends all adults over the age of 65 get 2 pneumococcal vaccines. Prevnar protects against 13 strains of pneumococcal bacteria, and Pneumovax protects against 23 strains. All people over the age of 65 should get a dose of Prevnar, followed by a dose of Pneumovax at least 8 weeks later. If you received a dose of Pneumovax before you turned 65, your physician may recommend that you get a second dose. Most states allow your pharmacist to administer these vaccines, and Medicare covers the cost. Ask your personal pharmacist if they administer vaccines and which ones you need to get so that you can avoid these dangerous diseases. Finally, talk to your doctor and ask if you need booster shots against other diseases such as measles, hepatitis A, hepatitis B, mumps, rubella, and meningitis. Some physicians are recommending these booster vaccines to elderly people if they have certain health issues or if they work in high-risk jobs. I have written an ebook that helps parents and children address subjects that may be difficult to bring up but are necessary to plan for the future. You will find the link to get this free resource in the description below. I'm sure it will help start the conversations that are so important. If you found this video helpful in informing you what vaccines are recommended for older adults, please give it a thumbs up and recommend it to your friends. Do you have any questions about vaccines that are recommended for older adults? Please leave your questions in the comments below, and I'll do my best to answer them. Thank you for joining me today to learn what vaccines your parents or maybe you need to be getting. I hope this information helps you avoid the serious effect of these diseases. Have a blessed week.